Chambers and sulcus of the heart. The heart has 4 chambers. 2 superior receiving chambers called atria and 2 inferior pumping chambers called ventricles. The surface of the heart contains grooves called sulci, which house coronary blood vessels and variable amounts of fat. The right atrium is the upper right heart chamber that receives deoxygenated blood from the body via the superior vena cava, inferior vena cava, and coronary sinus. It pumps blood to the right ventricle through the tricuspid valve, which prevents backflow. Key features include the fossa ovalis, pectinate muscles and avenue valve. The right ventricle is one of the heart's 4 chambers, located on the lower right side. It receives deoxygenated blood from the right atrium through the tricuspid valve and pumps it to the lungs via the pulmonary artery. Structurally, it has thinner walls than the left ventricle, as it only needs to pump blood a short distance. The left ventricle is the largest and strongest chamber of the heart, located on its lower left side. It receives oxygen-rich blood from the left atrium through the mitral valve and pumps it to the rest of the body via the aorta during contraction. The left ventricle's walls are thick and muscular, designed to generate high pressure for systemic circulation. The left atrium is one of the 4 chambers of the heart, located in its upper left portion. It receives oxygen-rich blood from the lungs through the pulmonary veins and passes it to the left ventricle via the mitral valve. The left atrium has thin walls but plays a critical role in collecting blood and ensuring smooth flow into the left ventricle during diastole. Sulci mark the external boundaries between the chambers of the heart. The coronary sulcus encircles most of the heart, marking the boundary between the superior atria and the inferior ventricles. The atrioventricular groove, also called the coronary sulcus, is a surface groove on the heart marking the boundary between the atria and ventricles. It contains vital structures like the right coronary artery, left circumflex artery, and coronary sinus, which support blood supply and drainage for the heart. The anterior interventricular sulci is a shallow groove on the anterior surface, marking the boundary between the right and left ventricles. The anterior interventricular sulcus is a groove on the front of the heart, separating the right and left ventricles. It contains the anterior interventricular artery and great cardiac vein, crucial for heart blood supply. The posterior interventricular sulcus continues from the anterior side to the posterior surface of the heart, marking the boundary between the ventricles on the back side.